I'm Elizabeth Moss, the Chief Operating Officer for the Clinical Research Network East Midlands. It's December 2015 and this is one of my regular COO video blogs. This month it's been decided that these video blogs will be available more widely, so rather than just going to the internal CRN team as available through Google, they'll also be made available through a different platform to ensure that the wider CRN across the region can have access to this regular short video blog, and this will continue into 2016. So for those of you who've not seen this blog before, the purpose is to be a very short video for me to provide an update to each of you as to what's been happening in the network and key priorities for the month and years ahead. So at the moment, one of the things I wanted to talk about was performance, and it's a mixed picture. So overall, our recruitment performance increased from previous months, although it is below our aspirational target. At the moment, we're sitting on about 80% of our year-to-date recruitment goal, which has moved further than where we were previously, which is around the 60–65% mark, which shows a really good increase. But obviously, it's still not where we want to be in terms of our recruitment. We know one of the reasons for this increase is because it's the activity-based funding cut-off deadline at the end of September, which saw a surge in recruitment, but we just hope we can maintain levels around 80–85%. If we could hit 90%, that would be great, although I think 100% is probably unlikely because our stretch target of over 56,000 is going to be quite difficult. We've seen some performance highlights within that recruitment though in this past month. We've seen a big increase for Division 2. There's quite a lot of recruitment's been uploaded for a particular study which has been recently adopted onto the portfolio. So well done Division 2, that's the Girls Active study within diabetes. Another highlight within our overall performance is in relation to recruitment time and target for commercial studies. The national goal is to be 80% of studies to be recruiting to time and target. And currently we're sitting at 77%, which again, whilst not where we'd want it to be, not 80% or over, we are top across the country for commercial activity performance, which means we're going in the right direction. Probably the only other item to note in our performance report this month is that our RM&G study-wide activity sees us falling below the required metric of 80%. We've fallen to 77% of studies turned around in that 30-day timeline. And actually, in honesty, I'm not surprised by this because we have seen a significant reduction in workforce for RM&G. And I have to say, I think the staff who are in those posts are doing an incredible job in light of the fact that we've seen a reduction in staff. And we've only seen a small drop in the performance, so I think they are doing very well. A lot of work's been undertaken, particularly with NUH, to ensure best use of resource, working more closely with the R&I team, and we hope to see more moves like that across the other organisations, particularly as we work to setting up the study support service. So outside of just performance, there are a few other things to talk to you about. One of those is budget planning. At the moment, we're planning for our 2016-17 budget. We won't know what our final budget is until February, but we're doing some planning, making some assumptions, doing some forecasting and modelling as to what our budget will be overall and how we allocate that out to our partner organisations and then work with them to plan their budgets. The intention is that by mid-December, so within the next week or so, we will have budget envelopes ready for partners and be able to start that dialogue. The model for preparing budgets is activity-based, or activity-driven rather, which means that we've looked at recruitment activity, complexity of recruitment, along with historic allocations and making sure organisations are not significantly destabilised by having a sort of smoothing effect from year to year, so that although the activity drives the budget, it's not the only factor when setting the budget. In terms of staffing, to update this month, Penny Millward has joined as the Operations Manager for Divisions 1 and 3, working closely with Hannah Finch. I'm sure you'll all welcome Penny into the network, and we'll be meeting her over the weeks and months to come as she supports you in your role or across the organisations that we work with. Another new addition to the network will be Roz Sorrie. She's joining us hopefully probably end of December or early January into the role of Senior RM&G Manager, supporting the RM&G function, which I think is really welcome at this time. Another thing to update is about EDGE. So we're at the position now where 10 of our partners are fully live with the EDGE system, and that we've been working really hard with people about how they use their instance of EDGE and what works and doesn't work. In this vein, we're holding two relatively informal events in January, one on the 25th at Glenville Hospital and one on the 29th in a Derby location to be confirmed, for EDGE users to talk about how the systems work, how to get the best out of the system and use it to best effect. So I'm sure more information will be going out about that quite soon. We're also establishing a primary care instance, and the intention is for this to go live in early January. This is something fairly unique in the East Midlands. Other networks are tackling primary care in different ways, but we are establishing an instance for primary care to make sure we're capturing and recording all the data for studies undertaken in that care setting. Another thing I wanted to update you about was the research awards. We're keen very soon to launch some East Midland-wide research awards to recognise contributions to research across the region. So there'll be a number of categories, and we're just in the process of defining those and being very clear with people what we'll be looking for when making applications to apply for a research award. And it's about recognising good performance and rewarding that within the region. Well, I anticipate that we'll have some kind of award ceremony towards the end of this year or early next year, and we'll bring together a lot of the shortlisted nominees and make final decisions. We'll have some kind of panel to agree that, and it may well be that many of you are asked to get involved in that, either in terms of making nominations or in the panel itself making the decisions. The other thing I just wanted to mention was the study support service. Some of you will know that the CRN is tasked with establishing this over the coming months, and certainly that it becomes more operational into 2016-17. There's a lot of national work which we are getting involved in, but we're also defining our plans locally. So the study support service really best describes the work of many elements of the network, so from research ideas, supporting researchers with their applications for grants, costings, etc., supporting them with defining sites, setting up studies, the ongoing performance management of studies and close down of those studies. So different elements of the CRN are already supporting this, but we're bringing it together into a more cohesive approach. We've set up a programme board for this piece of work, and we're currently establishing two pilot pieces of work, one for researchers in primary care and a second for researchers in mental health settings. I anticipate that we will start the primary care pilot in January and then further prepare the mental health pilot so that it will go to the programme board for comment and review in January, and then further discussion with stakeholders. We're then looking at how we roll the programme out more widely, and key here is that we don't duplicate any work around the HRA approvals process, and that we work in collaboration with all of our partners. So I'm sure many of you will be finding a lot more about this in due course, and we do want to work with you as we roll this out. That was my update for December, and I'm sure I'll be in touch with you in the new year. Happy Christmas.